The thorax is the region of the body that's found in between the neck and the abdomen. It is flat in front and back, and it is rounded at the sides. Its framework is what we call the thoracic cage, which is made posteriorly by the vertebral column, laterally by the ribs and the intercostal spaces. Superiorly, it communicates with the neck, and inferiorly, it is separated from the abdomen by the diaphragm, which is a muscle. Its function include protecting the heart and the lungs and other organs that are found within the chest. Hello everyone and welcome to Annotated Medical Tutorials. This is a channel specifically designed to simplify medical concepts. If you haven't yet subscribed to our channel, please click the subscribe button and the notifications bell so that you can be notified whenever we upload a new video. In today's tutorial, we'll focus on the anatomy of the thoracic cage. We'll focus on the ribs and classify them. Then we'll also look at the joints of the chest wall. We'll also take a quick look at the intercostal muscles, the blood supply, venous drainage, and the nerve supply to the thoracic cage. Like I said, posteriorly we've got thoracic vertebra number 1, number 2, up until we reach thoracic vertebra number 12. Now let's start off by looking at the ribs. We have got 12 pairs of ribs, and we need to know how to categorize them. So we've got 3 categories of ribs. The first one, we've got true ribs, we've got false ribs, and we have floating ribs. And a true rib is the one that attaches to the sternum by means of costal cartilage. So we've got number 1 to number 7 being the true. Number 8, 9, and 10 are false ribs. 11 and 12 are floating. So all the 12 pairs of ribs are attached posteriorly to the vertebral column. But only the true ribs are attached directly to the sternum by means of costal cartilages. The costal cartilages of rib number 8, 9, and 10 are attached to the sternum via the costal cartilage of rib number 7. So these 3 are false ribs. The costal cartilages of rib number 11 and number 12 do not attach to the sternum. They are free floating and they are embedded in the musculature of the abdomen. So now let's take a quick look at the structure of an individual typical rib. You need to know the parts of an individual typical rib, because in the Viva exam they can give you a rib and even ask you to classify it, then name the parts of the rib. So a typical rib has got a head, a neck, a tubercle, an angle, a shaft, and it attaches anteriorly to the sternum by means of a costal cartilage. So if you are to take a cross-sectional look of the shaft of a typical rib, you will realize that it has got a smooth and rounded posterior border and a very sharp inferior border that has got a groove inside called the costal groove. So this groove is where a vein, an artery, and a nerve are found. So that when we want to drain excess fluid from the chest, a needle shouldn't be inserted below the rib, simply because you can of the risk of injuring the costal nerve. So the needle should be inserted above the rib where you don't find the intercostal nerve. The head of a typical rib contains 2 facets. The first facet is for articulation with the vertebral body of the thoracic vertebra, which is numerically corresponding to the rib. And the second one is for articulation with the vertebral body of the thoracic vertebra immediately above the rib. The tubercle also has a facet for articulation with the transverse process of the thoracic vertebra. Now let's draw the thoracic vertebra. It has got a heart-shaped body there, and an intervertebral disc there. It has got a vertebral canal for the spinal cord, and it has got 3 processes. And indicated in blue are the facets for articulation. There we've got a heart-shaped body and a pedicle. There is the vertebral canal, which is rounded and it's got the spinal cord. There is the demifacet for articulation with the rib. We've got 2 transverse processes, one on either side. And then we've got a spinous process above. There is the demifacet, actually a facet for articulation with the tubercle of the rib. So now that we have discussed the structure of a typical rib, we won't be discussing about atypical ribs, simply because of the debate amongst authors on which ribs qualify to be atypical ones. So we'll move on to the joints of the thoracic wall. So we'll start off by looking at the joints between the ribs and the thoracic vertebra. So the first rib and the lowest 3 ribs have got a single synovial joint with the thoracic vertebra. And the rest of the ribs, which is the 2nd to the 9th, have got synovial joints with the vertebral bodies of the numerically corresponding thoracic vertebra and that which is directly above. So they form 2 joints with the numerically corresponding thoracic vertebra and that which is above. Another point of note is that there is an intra-articular ligament which is strong, which attaches the head to the vertebral disc, intervertebral disc. The next type of joints that we are going to look at are very easy. We've got the ribs and the costal cartilages articulating with one another, and this joint is a cartilaginous joint that allows no movement at all. So we now move on to the joints between the costal cartilages and the sternum. The first costal cartilage articulates with the manubrium, and this is via a cartilaginous joint with no movement allowed. The 2nd to the 7th rib articulate with the sternum by means of synovial joints. Costal cartilage is number 6, according to Richard Snell. 7, 8, 9, 10 articulate with one another via synovial joints. So number 6, 7, 8, 9, and 10 articulate with one another via synovial joints. Rib number 12 and number 11 are embedded in abdominal musculature. So they are free-floating ribs. So by now we are at a point of asking what exactly occupies the space in between ribs, which we call the intercostal spaces. So this area is occupied by muscles called intercostal muscles, and we've got 3 types of intercostal muscles. The first one is called the external intercostal muscle, which has got fibers which originate from the lower border of the rib above and insert on the upper border of the lower rib. So there's an area where the muscle doesn't continue and it is finished by an intercostal membrane, which I indicate in green like this. This is called an anterior intercostal membrane. So again, the fibers of the external intercostal muscle originate from the lower border of the upper rib and move downwards and forwards to insert on the upper border of the lower rib. And as we go forward anteriorly, there's a part where the muscle discontinues and it is finished by the anterior intercostal membrane, which is a membranous structure, not musculature. So in the next intercostal space, I'm going to indicate the internal intercostal muscle, which is medial to the external intercostal muscle. This muscle's fibers run downwards but backwards up until we reach the point of the angle of the rib, where it is finished by the posterior intercostal membrane. This is also in a membranous structure. Now let us indicate these muscles clearly by drawing the cross section of the thoracic cage. There we have got the thoracic vertebra posteriorly, and then anteriorly we have got the position of the sternum there. Now the external intercostal muscles goes from the posterior aspect anteriorly, and then it is finished by the anterior intercostal membrane like that, and then the other side finished by the anterior intercostal membrane like that. Now medial to this muscle, there is the internal intercostal muscle, which comes from the sternum, lateral aspect of the sternum, and it goes like that. It continues up until it reaches the angle of the rib. Then it is finished by the posterior intercostal membrane, which is also a membranous structure. Let's just label them. Here we've got the anterior intercostal membrane, and then there we have got the posterior intercostal membrane. Inside this we have got an incomplete layer of muscle, commonly referred to as the transverse thoracis. It comes in 3 parts. So to label them, on the anterior part we have got the subcostalis. This is not called the subcostalis, it's called the stenocostalis. And then posteriorly we have got the subcostalis now. And then here we have got the intercostal intimus. So just a quick reminder, in the intercostal space we have got 3 layers of muscle: the external intercostal muscle, the internal intercostal muscle, and the transverse thoracic. And now, before we go to blood supply and the nerves, let's indicate the position of the parietal pleura there. And then on the outside, I'm going to indicate the position of the skin, which overlies the subcutaneous tissue that's there. Now we're in a position to put the nerve supply to the intercostal spaces, and there we've got the spinal cord inside the vertebral canal. So from that we get the posterior root coming out like that and the anterior root coming out like that. Together they combine and form the spinal nerve inside the vertebral foramen. Once it comes out, it gives off a posterior primary rami, which goes backwards and divides to form 2 branches like that, and it will supply the postvertebral muscles at the back there and the skin of the back. Unfortunately, the yellow part is not making much difference, and we're going to be replacing it by orange like that. So there we've got the posterior primary ramus, and then the anterior primary ramus continues within the space between the transverse thoracic muscle and the internal intercostal muscle. So it actually enters the intercostal space at a layer in between the subcostalis and the posterior intercostal membrane, which is a continuation of the internal intercostal muscle. So the anterior primary ramus continues in the space between the transverse thoracic and the internal intercostal muscle, and then it goes like that up until it reaches a point where it pierces in front. Then it will give the anterior cutaneous branch, which will divide into two parts, the lateral and the medial one. But note that halfway down, it will give off a branch called the lateral cutaneous branch, which will pierce like this, and it will divide to form these two parts, such that the whole area of the skin is supplied by one nerve, and this is a dermatome. So as it goes down, it gives off branches to the intercostal muscles, and it will supply the skin, the intercostal muscles, and the costal part of the parietal pleura. Now again, let's look at the structure supplied by one nerve. We have got the whole thickness of the intercostal muscles, the skin covering it, and the parietal pleura. So the whole area, let's say if it was T4, the whole area, the skin, the whole thickness of muscles, and the parietal pleura are supplied by the same intercostal nerve. Please note that this arrangement is only for the second to the sixth intercostal spaces, and once we go beyond that, please note that the intercostal nerves do not only supply the skin, the intercostal muscles, and the parietal pleura, but it also goes down to supply the skin of the abdomen, the abdominal muscles, and the parietal peritoneum. So the 7th, the 8th, 9th, 10th, and the 11th do not only supply the skin and the whole thickness of the intercostal space and the parietal pleura, but also goes down into the abdomen and supply the skin of the abdomen, the muscles of the abdomen, and the parietal peritoneum. So on the other side, let's indicate the blood supply to a typical intercostal space. There we've got the junction of the arc of the aorta and the descending thoracic aorta. From there we've got a branch. Let's say this is at the level of T4. From there we've got a branch called the posterior intercostal artery, which goes off like that and enters the interval between the transverse thoracis and the posterior intercostal membrane. So as it passes, it gives off a branch that's going to supply the skin at the back there and the postvertebral muscles. Then it will continue like that within the space between the transverse thoracis and the internal intercostal muscle, and it goes down like that, where it will then go and end lateral to the clavicle. But as it goes there, it supplies the whole thickness of the muscles and the skin, and it will also give blood supply to the parietal pleura. Now in front there, just a finger breadth lateral to the sternum, we've got the internal thoracic artery, which is a branch, the first branch of the subclavian artery, and it descends down a finger breadth lateral to the sternum, just behind the costal cartilages, up until the sixth intercostal space, where it will divide into the musculophrenic and the superior epigastric artery. But as it descends, it will give an anterior intercostal artery there, which will anastomose with the posterior intercostal artery, and it will also give a perforating branch that will supply the skin and the subcutaneous tissue in the front like that. So if we were to compare both sides on the nerve supply and the blood supply, we will realize that on the nerve supply, we've got the anterior primary ramus continuing as the intercostal nerve, and it supplies the whole thickness of the intercostal space, including the muscles and the skin and the subcutaneous tissue, and it also supply. And one thing to note is that as it runs in the intercostal space, it's in between the transverse thoracic and the internal intercostal muscle. And then on the other side, we've got the same artery supplying the whole thickness of the intercostal space, the subcutaneous tissue, and the skin, and it also supplies the parietal pleura. This marks the end of the first chapter of the thorax, which focused on the thoracic wall. If you found this video helpful, please don't forget to subscribe and click on the notifications bell so that you can be notified whenever we upload a new video. And also, if you want chapter 2 of this topic, which focuses on the organs that are found within the thorax, also look at the description box below for the link. If you also wish to practice some MCQ questions on the thoracic wall, also look at the description box below. And also don't forget to comment and like this video. Thank you.